Very good evening, fellow Zimbabweans. We come again tonight just to discuss issues around COVID-19 outbreak and see how we can move forward and what challenges we are facing right now in Zimbabwe. Anxiety and fear are reigning supreme right now in the hearts and minds of all Zimbabweans due to this COVID-19 outbreak. It's now deeply rooted in our country. We believe that there is still hope for our nation to flatten this epidemic and reach negligible peak levels if we take drastic measures, which we wish to reiterate today. But first of all, we want to give our sincere condolences to the Makamba family and indeed to all Zimbabweans on the untimely loss of our second confirmed COVID-19 case, Zororo. Our hearts go out to the family in solidarity, and we take very seriously all the observations they made about our unpreparedness for this disaster and the hardships and mental torment that they had to endure as a family. This is a wake-up call for all Zimbabweans, and we must respond promptly and appropriately to this challenge. I must point out that this brings our case fatality rate to 50%. We had 2 cases and we lost 1. This is not acceptable. Let's watch this number as we go along. We must achieve case fatality rates of a fraction of 1%. Then we'll know that our healthcare delivery system is working as it should. The big lesson we learned from this first fatality is that preparedness is not something that we can only wish for. But we've got to work hard at it and deploy resources big time towards preparedness for the disaster. Mere reassurance from those in authority will not work. Waiting for donations is not a viable option. We must take the lead in prioritizing healthcare in our own expenditures. And Lord, let those who help us come in to help us on the back of what we are doing as a nation. At the end of the 60 days or so that this outbreak will last, we want to look back with satisfaction and say that that money was well worth spending. To that end, we ask government to suspend all non-life-saving program expenditures and channel resources to healthcare for the next 2 to 3 months. We have another disaster looming. Healthcare workers cannot continue to work in this toxic environment without the necessary personal protective equipment, which we refer to as PPE. We have noted how healthcare workers died in countries and economies much tougher than ours. In Italy, 4,800 health workers have been infected by this virus already. And this is about 9% of the total cases that they have experienced. That's a huge number. Healthcare workers are in the forefront of this battle and they will be infected. We must give them all the protection that we can as a nation. We should not sacrifice any doctor or nurse on the altar of self-imposed poverty in a country that is so well endowed with natural resources. It is imperative that government provides forthwith the necessary PPE for health workers so that they can come to work with the confidence that they will be able to return home in the evening safely. At this point in time, we wish to emphasize that we are firmly behind the health workers for demanding proper working conditions in the face of a highly infectious virus. Provision of water at all our hospitals is also non-negotiable. We urge the government to go the extra mile and give a risk allowance as requested by some of the health workers. This has been done in the past. If you recall, during our cholera outbreak 2008-2009, and it went a long way towards incentivizing the health workers to continue to serve the nation in very dangerous environments. We want to point out and emphasize at this stage that any non-availability of health workers at our healthcare institutions and ensuing disastrous consequences will be squarely on the shoulders of this government. So we urge you to take every measure you can to finance healthcare at this point in time while we still can. We still have a window of opportunity and we don't want to waste it. It's quite a narrow window of opportunity. We further urge the government to institute a total lockdown of all our cities and to close all borders except for the most essential cargo. Communication with the public is key at all times, and we must continue to communicate the message of prevention, prevention, prevention. How do our people prevent getting infected with COVID-19? Let's emphasize the issue of hand washing, the issue of sanitizers, very frequent hand washing, the issue of social distancing, the issue of banning all gatherings, and the issue of working from home whenever we can, self-isolation if you think you've been exposed, and we want to encourage telephonic consultations for those who can consult their doctors per telephone. That helps a lot. We wish to appreciate the international community for your valued assistance, our local authorities for the hard work and taking the challenge head on under very difficult circumstances, and we want to appreciate all our healthcare workers who have put their lives on the line up till now. And we want to finally appreciate all Zimbabweans for your great fortitude under very difficult social and economic circumstances. We will subdue the virus if we climb with care and confidence, looking after each other's needs, watching each other's back, and prioritizing health care. I want to thank you for your time.